Good morning and welcome everyone to WorkSafe ACT's breakfast series, kicking off with the health industry, and it's so wonderful to see everyone getting up early on this wet, I don't think a cold morning, but a bit of a boggy morning. Before we kick off with the content, I'd like to welcome the fabulous Auntie Violet to join me up here on stage. Look, a big round of applause for Auntie Violet. I think there's about 10 of Auntie Violets because she's always everywhere. Auntie Violet, thank you. Lovely to see you.
Jacqui, lovely to see you. Can't you white fellas sleep in? Oh my God, I was up at 5:30 this morning. I'll have to do a nanny nap this afternoon or put 2 matchbox under the eyelids. But it is my pleasure to be here and welcome you to the land of the Ngunnawal people, my mother's country. But I'd also, before I go into my welcome, I'd like to acknowledge Rachel Stevens-Smith. Oh my God, see, I'm half asleep. I can't even get names right. Health Minister, Jacqui Agius, Speaker Dr. Narelle and other guests in the room. So I'm looking interested in listening to the speakers, to the panel. But I do school pickups, school drop-off this morning. So I said to Kevy this morning, if it's raining, I might let you stay home because you don't have. It's unsafe to ride your scooter. So he's praying that it's raining. So I woke up this morning. So thank you all for inviting me along. I look forward to the next lot of sessions on the go. So I'd like to pay my respects to my elders, past, present and emerging, and extend that respect to any First Nations people here this morning. But I'd like to also acknowledge all the non-Indigenous people here as well. In keeping in the general spirit of friendship and reconciliation, it gives me great pleasure once again to welcome you to the land of the Ngunnawal people. And on behalf of my family and the other Ngunnawal families, I say welcome, welcome. Thank you all so much. Have a great morning. And maybe you might be able to have a nanny nap this afternoon. Thank you.
Thank you, Auntie Violet. And for the major part you play here in reconciliation, and always a cracking welcome to country. And I think we can all take the rest of the day off if you ride your scooters to work, because it is raining. My name is Lish Faya, and it's my absolute delight to be here. I am a mornings person, so this is absolutely perfect for this. And I suspect most of you in the room are not unfamiliar with early mornings. So thank you for getting up to come to a WHS breakfast. I think the combination that WorkSafe ACT has got today, which is breakfast with a really strong health and safety message, is the perfect combo. So really appreciate you hitting it. Now, lots of people in the room today that have a strong investment in workplace safety in the health industry. So I'd like to say a welcome and thank you for joining us. Dave Peffer, who's the CEO of Canberra Health Services. Thank you, Dave. I know as well we've got health workers, of course, the backbone of the whole industry, union reps, members, WHS experts, and our Minister. Where is Minister? Thank you, Minister. Minister Rachel Stevens-Smith, and I think Minister Emma Davidson, Minister for Mental Health, will join us as well this morning. Now, the idea behind these breakfasts is really to put a focus on WHS in the workplace. And I know, I think I work for the ABC, and I've worked in various places in my life, and whenever I've done workplace, OH&S as it was in my day, but workplace training, I seem to recall having a box in the centre of the room and us all having to navigate the box and then approach the box and then pick up the box and learn how the physical risks of workplaces. But I think the focus on these breakfasts across the series is going to be psychosocial hazards and how to manage them. Can I just get a show of hands who has heard that term, psychosocial hazard? Great, because I hadn't. I've just worked with the box. So it's really great that we're talking about this because it's a hazard that's hard to see often. It's not this thing that you see. So I'm so pleased that we are looking at this. And it's so inherent in the work you do as in health. I just want to be a bit of a grandmother, even though I'm not, but you know how your granny used to always send you little cutouts from magazines? I was reading this on the weekend. Steve Robson, head of the AMA, wrote an incredible article in This Weekend magazine. And if you get a chance to read it, but it pretty much defines what I think we're going to talk about today. Did anyone read it? It's The Australian. That's not a political comment. But he wrote, he didn't get a ghostwriter, I fully understand, but but he tells a really incredible story of his starting out as a young doctor up in Rockhampton, and it was only the colleagues' care that saved his life. It's a remarkable story, and I'm happy to cut out and put it in an envelope and send it to you if you want. But what I just want to read the back, the very last paragraph he ends with, which was, I was more lucky than I could have ever imagined. I was saved by a caring colleague at the last moment, but it should not fall to colleagues to save their own. That is the responsibility of the systems that run our hospitals and medical training institutions. Unfortunately, this message has not gotten through yet, despite the evidence of harms the system inflicts. Each life lost is a tragedy that further diminishes our system. I should know. So it's a remarkable article. So with that, not a jolly note, but I think a really jolly good start to introduce this incredible and important topic. Let's kick the morning off. We have such a wealth of expertise in this room, and joining us on stage to talk about this topic, Jacqui Agius, the Work Health and Safety Commissioner here in the ACT, Labour Hire Licence Commissioner as well. Big warm welcome for Jacqui, who's hosting us this morning as well. Thank you, Jacqui. Now, Jacqui has all the experience in workplace health and safety, and she brings all that experience to every bit of work she does here, and such integrity in the work she does. So Jacqui is going to speak first. Then we have Dr. Narelle Beer, also in workplace health and safety from Victoria. She's the ED of Health and Safety at WorkSafe Victoria. And then finally, the legal and regulatory frameworks around this, Aaron Guilfoyle, practice leader and WHS regulatory and prosecutions. But Jacqui, would you like to kick us off with would you like this microphone?
Yes.
Yeah, great. Yeah, absolutely. I'll step away.
Thank you. Thank goodness Lish is a morning person, because she brings all that wonderful energy with her that none of us else feel, or that we're all pretending to feel. Good morning, and congratulations for making it here on this chilly, rainy Canberra morning. I suspect some people are running late because I'm sure that the traffic and the weather have held people up. But welcome to Minister Stephen Smith, union representatives, industry representatives and workers. Thank you, Narelle and Aaron, for agreeing to participate in our panel this morning and for sharing your expertise with us. And of course, it's wonderful to have you, Lish. Auntie Violet, thank you for your welcome to country. This week is National Reconciliation Week. It is the time for all of us to learn about our shared histories, cultures and achievements. We are meeting on Aboriginal land. I acknowledge Aboriginal and Torres Strait Islander people who are joining today's event. All workers in all workplaces have a right to a safe workplace. In June 2022, the International Labour Organisation recognised a worker's right to a safe and healthy work environment. Last October, WorkSafe ACT held a number of safety sessions across the ACT. In those safety sessions, there was one common question, and that question was, what the hell is a psychosocial hazard? So before we get too far into things, let's make sure we're all on the same page. Psychological health and safety is not the same as mental health, and wellbeing programs do not control psychosocial hazards. Psychological safety is the way in which a workplace prevents the psychological harm of its workers. And psychosocial hazards come from aspects of the work environment, from the management practices and the way that the work is organised. And it covers a broad range of things. And some of those things include high job demands, so such as unmanageable workloads or role ambiguity or lack of organising and planning work. It includes hazards such as low job resources, such as inadequate staffing, inadequate supervision, and inadequate manager support, lack of role clarity and lack of consultation. A poor physical environment is a psychosocial hazard, and it includes badly maintained amenities or unpleasant workplace conditions, isolation and exposure to traumatic events and material. Where workers are exposed to repeated and uncontrolled psychosocial hazards, they can become stressed, burned out and fatigued. Of course, some stress on its own is not an injury, and in fact, for some of us, stress can be an effective motivator. But excessive or sustained stress can cause a physical and/or a psychological harm. Oh, I'm forgetting this, aren't I? I always do this. I get so caught up in what I'm saying that I forget to change the slide. So we're going to do a little thing this morning. If you notice that I forget to click on to change the slide, put your hand up, and so that I can prompt me. So we're here this morning to talk about work health and safety in the health industry. Let me share some local data to give you a bit of an ACT context. Out of 70 workplace visits in the health industry so far this year, 49 of those visits were reactive and 21 visits were proactive. WorkSafe's proactive visits are conducted in high-risk industries. While conducting reactive visits in the health industry, WorkSafe inspectors issued 68 improvement notices, 1 non-disturbance notice and 4 prohibition notices. Just Narelle, don't write those figures down because I know Victoria is much larger than the ACT, and so when we talk about 4 prohibition notices, that's actually a lot in the ACT, but Narelle's probably going to talk about something like 400 prohibition notices in health. Out of the 75 notices issued in the healthcare and social services industry so far this financial year, 73 were issued during reactive visits. So 73 out of the 75. A reactive visit is in response to a complaint, an inquiry or a notifiable incident. And the data in relation to reactive visits is telling, as it indicates a number of things. Firstly, it indicates that either when workers raise safety complaints, they are not being addressed adequately by the workplace, or it can indicate that workers are too afraid to raise safety complaints within their workplace, and so they come straight to us as the regulator. We know that lots of minor breaches of the WHS Act can lead to more serious injuries, particularly if the breaches are in relation to psychosocial hazards, as the likelihood of repeated psychosocial hazards resulting in a compound psychological injury is extremely high. When psychosocial hazards are not adequately risk managed, the likelihood of bullying and harassment, gender-based violence, sexual harassment and work-related stress increases. And incidents of this type can lead to psychological injuries and, of course, more workers' compensation claims. And we know that in the health industry that workers' compensation claims are 3 times more likely for women in that industry than they are for men. Nationally, over the last 10 years, the rise of accepted workers' compensation claims for psychological injuries has steadily increased, while the accepted workers' compensation claims for physical injuries have decreased. Now is the time to take action to ensure all workers in all workplaces go home from work and back to their loved ones healthy and safe. This is our challenge. It is our moral obligation and it is our legal obligation. Thank you.
Thank you so much, Jacqui. And I can hear that the healthy competition between WorkSafe Victoria and WorkSafe ACT coming there. So let me introduce Dr. Narelle Beer, who is the Executive Director of Health and Safety at WorkSafe Victoria. Now, Narelle has worked in this industry for a very long time, so engagement, education, compliance, enforcement, she's the full bottle, and I think you have a few more runs on the board in terms of how this is all managed and how, I guess, Narelle, we're going to have a Q&A after we hear from Narelle and Aaron as well, but I'm really interested to hear how all this plays out in terms of here in the ACT and compliance.
Thank you so much for inviting me here. I really appreciate being here, and thank you, Jacqui, and distinguished guests, ladies and gentlemen. I'd also like to acknowledge the traditional custodians on the land on which we're all meeting today, and I want to thank you, Auntie Violet, A, for the amazing welcome, but B, for the reason now I'm going to have a nanny nap this afternoon. I'd also like to acknowledge any other First Nation folk that might be here today. Now, I've got to remember to do this. Green button, they tell me. Oh, next one. Maybe? Oh, I've got it wrong already. So WorkSafe Victoria has a twofold operation, which is probably a little bit different to some of the other WorkSafe areas. On one hand, we are the workplace insurer. So our obligation and our objective in that case is to get people back to work, back to healthy work, by ensuring they have personalised treatment to support them in their recovery from an injury that occurs in the workplace. But we also have a major role to play in reducing the harm to ensure that people don't get hurt at all. And to fulfil that purpose, we approach every fatality, every workplace injury, every workplace illness as completely preventable. And I'm happy to argue or debate till the cows come home anyone who suggests otherwise. Every workplace injury is absolutely preventable. And under the OH&S Act for Victoria, employers have an obligation to ensure that there is a safe workplace without risk as far as reasonably practicable. And under Section 5 of that Act, it's defining health as not just physical health, but also psychological health. So employers and duty holders have an inherent obligation to ensure the health and safety of folks in their workplace, and they need to manage any risks they identify and eliminate where possible. And we know our health industry in particular faces significant challenges in trying to do this whilst ensuring the best possible care for their patients. And let's not forget the pressures, the fatigue, the stresses they face during the pandemic. So it will come as no surprise to you to hear that the health industry faces working long hours, the fatigue that results as a result of that, and then that leads to interpersonal conflicts, and we know threats of physical harm simply for doing their job. And of those challenges, exposure to work-related violence is probably the most unacceptable, and yet it's really, really common. I'm sad to say that my statistics, Jacqui, in Victoria are really high at the wrong end. So between 2023 and 2022, the growth in mental injury claims in the health sector increased by 25% in Victoria. 25%. So not only do acts that cause physical harm have an impact, but they also have a really profound impact on psychosocial injury. And we know, as Jacqui's already said, psychosocial injury can present or be caused in so many different ways. We know it's high job demand. We know it's heavy workload, particularly when it's combined with trauma where people are being spat on or abused. And we know often it's a lack of peer support, and that was a great comment that you made this morning. But I'm going to be a little bit provocative today. I'm going to say that it's not only employees who can get harmed in the health sector, and I want to emphasise the fact that duty holders are required to ensure that anybody under their control or management also have the right to be protected. So this means that we in Victoria can and do look at safe systems of work. And this causes sometimes some tension, some rub with the health sector. Why are we looking at what happens in an operating theatre? Why are we looking at how somebody in a mental health facility is being managed? And I often hear, too often, we are the most over-regulated industry out there, so why do health and safety have to come in? And the answer's pretty clear. Because we are still seeing harm caused in that environment. Patient care is the responsibility of the doctor, but the safe systems around it are something that we will absolutely look into. More on that later. One of the easiest ways for employers and duty holders to understand what risks are in their workplace, particularly around psychosocial harm, is, wait for it, ask. Ask the people that are doing the job, those frontline workers. They know what's hard. They know what needs to be done. And whilst asking what's going on is only half of the story, the most important part is then listening to what's said. By engaging in open and honest conversation, respectful conversation, we can absolutely get a better understanding of the nature and the extent of the risks to health and safety in any workplace. And to involve the workers in those conversations will absolutely ensure that the outcomes, the safe outcomes, are much better embedded. So WorkSafe has a WorkWell program in Victoria where we provide a whole lot of information on this, and it's free. And for those in the academic world that can't cut and paste because of this plagiarism thing, we don't care. Take our information, rebadge it and use it, because we just want to get the message out there. Those programs outline control measures, policies, stories to help drive the change. And the control measures can include things like employing more staff, ensuring workers have sufficient breaks during their shifts, creating work systems that prevent workers manipulating rosters, engaging security staff and making sure that they're trained appropriately. I want to talk about a recent case, prosecution matter that we're dealing with in Victoria, the hospital setting, mental health institution, and we had a really vulnerable patient brought in. The medical practitioner said that the patient needed one-on-one supervision, and that didn't occur. So why didn't it occur? Because they didn't have the staff to do it. And I accept that for one shift. Potentially, I accept it for 2 shifts. On the 17th shift, when there was no support, the patient hung themselves and died. There's a safe system of work there that failed. And that's something that WorkSafe Victoria will absolutely prosecute. I want to talk about our compliance. Oh, I'm already here. As a regulator, we recognise that compliance and enforcement plays a significant role in reducing health injuries and illnesses in the workplace. And in Victoria, we use a wide range of compliance techniques, and that might be the improvement and prohibition notices, also infringement notices. We issue letters of warning and caution. We do enforceable undertakings, and we also look at prosecutions. So WorkSafe Victoria can prosecute an employer, or in our state, even if no serious injuries or fatalities have occurred. In fact, we've just prosecuted, or in the process of prosecuting, a school where a young student died overseas on a holiday because the safe systems of work back here weren't sufficient to support that student. So that's an important part of our work, identifying and preventing injuries and fatalities before they happen. And it's a point worth repeating. The injury, the illness, the fatality may not need to occur for WorkSafe Victoria to act. And the law is clear. Our responsibility to Victoria, to the Victorian community, is clear. And in fact, we are the second largest prosecuting agency in Victoria behind Victoria Police. And that's not to say Victoria's not a safe place to work, but it's to say that we will hold people accountable for those who don't make it safe. Last year, we prosecuted 153 matters. 54 of those matters were non-injury matters. $16 million in fines came back to WorkSafe to embed prevention opportunities. I want to talk about a matter with Monash Health. So on the 15th of April this year, Monash Health pleaded guilty, was convicted and fined $160,000 in relation to failing to remove a risk which had been identified in 2015. And that was a ligature point in a mental health facility. And in the sentencing, the judge said, the failure to check the risks established that the offenders made the offender's moral culpability high. Also stating that deterrence for the public was a paramount consideration in the sentencing, and His Honour had regard to the victim impact statements that were tendered and the grave impact the offending had on the deceased's family. Currently, in Victoria, I have 5 matters before the courts in relation to health. 2 of those relate to fatalities and 3 of those relate to serious injuries. We're looking at safe systems of work. I have to say, I'm often dismayed when I speak to folk in the health sector and they say to me, particularly in aged care, Narelle, people don't come to aged care to leave out the front door. Well, we're an ageing community and I will at some stage go to aged care, and I want to know that I'm going to be safe. I want to know that their obligations to me will be met. So I know that the health sector sometimes feels that they are over-regulated, but that doesn't change the need to provide a safe and secure working environment or environment for those who are visiting, attending, patients, part of, under the management and the duty or control of that duty holder. So I want to leave you with just one further point that Jacqui has made, and that is we all have the right to go home safe each and every day. It is a moral right and it is a legal right, and we all have loved ones and we absolutely want them to come home every day. So in Victoria, we will happily continue to prosecute each and every time we find that that duty of care has failed, because we owe it to the loved ones. Thank you.
Thank you, Narelle. And I think the prevention that you speak of, and also the ask what's needed and the listen to what is said. But on the regulation, now I'd like to invite up to the stage to speak Aaron Guilfoyle, who's the practice leader of WHS, Regulation and Prosecutions, and he works on both sides, both advising business on how to comply to all these regulations, and also advising and representing regulators in prosecutions. So Aaron, please give a round of applause.
Thanks very much for that introduction. Thanks, Jacqui, and to WorkSafe ACT for the opportunity to speak to this audience today. I can't help but conclude, I think Jacqui's been at the helm for maybe about 3 years now, that WorkSafe is winning its battle to improve worker safety at workplaces for the public as well. When you see such a turnout, such a great turnout at a breakfast event on a cold, for a Queenslander at least, a cold and wet Canberra morning. Jacqui's asked me to keep my opening remarks to 5 minutes so that we've got time for the Q&A. That's no mean feat for me. I'll do my best though. What I want to do is just really quickly in that 5 minutes hit some points that have occurred to me from my experience in work health and safety. That was for 3 years as Queensland's independent work health and safety prosecutor from 2019 to 2022, and then, as you heard in that intro, in the last couple of years, straddling both sides of the fence. So my practice, my firm's got this unique position of having prosecuted, and including in this space, in the health sector in Queensland, but then for the last 2 years, advising predominantly big business, including big business in health, in compliance. And that's been, for me, a fascinating experience. What has occurred to me in big business, including in the health sector, from when you're a career prosecutor, people kind of default to telling you absolutely nothing. And so in the last 2 years, I've got to, for the clients that we advise, know everything. And one of my takeaways has been that there is absolutely a desire to improve, at least for our clients who have engaged us, to improve safety at their workplaces, and that includes in the health sector. But the health sector is absolutely unique because of the tension. So everybody in every business, particularly big business, in deciding what safety controls, to not get too legalese, it's going to implement, has got to balance these competing tensions. But the difficulty or the unique position that the health sector finds itself in is in balancing the need to care for patients, the need to protect their safety, but at the same time not expose their workers to safety risks. One of those takeaways from my last 2 years for big business has been, look, I'll hit, I've only got 5 minutes, I'll go to my notes and return to that if I've got time. We've heard there's a focus on, in this sector and this morning, on psychosocial hazards and risk management. And that's absolutely what I identify as the key challenge. It's a key challenge for big business across Australia at the moment. In this sector, it's psychosocial hazards from, and we heard, I think, both speakers touch on it, particularly in public health, work overload. You've got this unique environment where you're trying to care for patients, not put yourself at risk, but funding, the funding to do what you want is quite simply not always there. So you've got isolated cases of bullying as well, but this significant risk of role overload in this unique setting. We're also seeing in decisions, prosecutions around the country, courts' decisions in those prosecutions, a focus on occupational violence. So psychological hazard, but it's where we're seeing a lot of the activity. And then touched on by Narelle, that harm to patients, including self-harm. And to kind of understand the tension and the competing perspectives there. When we were researching cases to speak this morning, revisiting some of the decisions over the last few years, I raised with another lawyer a recent decision where somebody had committed suicide in a care environment, and they said the courts found that the failure to intervene was the cause here, but it's the patient who caused it. And this is from an experienced lawyer, and I said, yes, the patient was clearly one of the causes. But, I drew analogies with life-saving, where we've unfortunately prosecuted some absolutely tragic outcomes with the death of children in public water facilities. Once you decide to undertake that task, and that's what's unique about prosecutions in this area, it's a failure to act. Criminal setting, usually we're looking at doing a criminal act. This is a failure to do an act which is criminal. And once you take on that responsibility, you have to do it to the best of your ability, because the outcome in that matter, and so many, tragically, is a fatality. So they're the three areas where we're seeing regulator activity and prosecution activity. What's also, I've mentioned the unique tension in this matter. What the authorities are demonstrating is that the higher the risk in a setting, and I've drawn analogies previously with policing, the more that has to be done. What I experienced as the independent prosecutor for 3 years, I can absolutely guarantee you, both in this sector and in policing and in military, is I don't think you understand. I don't think you understand that what we do is dangerous. It's inherently dangerous. My response, and the response of courts, has been to say, so you need to do even more. That's the reality. That doesn't make the job of leaders in this setting easy. In fact, I have great admiration for everybody who works in this sector, including the leaders, because of the difficult job that they've got. I think for big business, workplace health and safety compliance has never been more difficult. And I think for health, because predominantly it's about psychosocial hazard risk management, it's even more difficult again. One of the next takeaways then is this, and it's for big business across the board, not just in health, and it's from the many conversations that I've had with senior leaders in providing due diligence training, and that is more needs to be done, and you can't take your focus off the management of workplace health and safety risks. Second last takeaway for me over the last 5 years working exclusively in safety is there is a gap in knowledge, and even if there's not a gap in knowledge at senior levels, that's been our experience at least, and that's fine because the people we're talking to want to learn, that's why we're there. It's the verification. So all of the policies in the world and in big business, including health, we usually see the policies. But when the policies aren't followed, including on the 17th time, we can end up with a fatality. And it means that all of the hazard identification, the risk management, the development of great controls, the training of our people in the controls amounts to zero, and people die. That's the challenge for business. Here's the last takeaway. That is, people die in this sector as business as usual and will continue to die. Where, I've already mentioned how offending in this space occurs. It occurs through not acting, almost always. Where somebody doesn't act and the injury is unexpected, because we do have professions where injury is expected. Contact sport. Injury affects those people, but they expect to get injured from time to time. People don't expect to get injured in this industry. They certainly, workers and the people put in the care of health sector workers, don't expect them to lose their lives prematurely. And in my 3 years as the independent prosecutor, I'll finish with this, the thing that stuck with me most is the impact on families from the premature loss of the life of a loved one. I spent countless hours talking through with families who'd lost loved ones why I couldn't do more for them, even though we'd done a lot for them. I couldn't bring anybody back. No penalty was ever going to compensate them for their loss. So I've mentioned already that, the challenge for big business, in health, is to constantly continue to improve, to make work health and safety compliance business as usual. And there's no better reason than to have to avoid sitting in the room like I did so many times with people who had life-altering injuries or worse, had prematurely lost their loved ones. Thank you.
I might invite Jacqui and Narelle back up to the stage. Use the stairs. Oh, use the stairs. Gee, at a WHS. Look at him. I know. That's right. Thank you, Aaron. we've got some questions now, and I know there'd be some questions in the room because there is so much in this. And when I said I hadn't heard of psychosocial risks, I think all of us know what they are. We've experienced them, whether it's as an employee or as a manager. And I think I've just called it burnout, and you just walk away. So it's all those identifying, assessing, controlling, reviewing, preventing, all what you've all spoken of. So I just want to kick off, Narelle first. And if anyone has a question, please raise your hand, and I think we've got some microphones that will go around. But Narelle, I've noticed that Victoria has prosecuted several health industry-related businesses. I wonder, have you seen a pattern developing where the industry is not meeting its WHS obligations?
What we do see is that the industry feels that they have enough regulation in terms of the clinical relationship that they potentially fail to identify some of the risks for those people that are under their control and their duty. And we are absolutely identifying that. But we also see that there seems to be a bit of a throwaway line. It's a really dangerous industry. We deal with people at their most vulnerable, et cetera, and potentially they don't give the power or they don't give the need to address those well enough. So we'll absolutely look into that, and we do. And I think it's really important because there's been some very recent studies that show that if you do have psychosocial injury, it actually ensures that if you have a physical injury, it brings that on quicker. If you are stressed, if you are tense, and then you pick something up or your muscles will go, and then suddenly you've got a second injury. And in Victoria, we know with a physical injury, we can get you back to work probably for about $195,000. We know that for a psychosocial injury, it's probably going to be close to $350,000, twice as long, and in fact, less likely to get you back to work. So the combination of the two is pretty scary.
And so much of you spoke about, just a lot of it in this industry especially, is the worker shortage. And take a worker out, overload them with too much work to take them out again, it just impounds that. And are you seeing a compounding effect in the health industry?
We certainly are, and WorkSafe Victoria is about to undertake a pilot where we're working extended hours. So we will turn up at emergency departments on a Saturday evening to identify what the rostering does look like. And if the rostering is really bad, what does that do for the safety of the workers and the patients that are coming in at that time? And how does management respond to that? The other thing that we're doing in Victoria is we are meeting with boards of large hospitals, and we're providing the boards with our data. And interestingly enough, sometimes they're seeing that data for the first time, and then they're going back and speaking to their executive and saying, there's a bit of a gap. This is a risk for us because directors have obligations and will be held accountable, and we do charge directors.
Don't you just love how Narelle thinks Victoria are the only state that does health and safety?
Yeah,
Just
exactly.
letting you know, this is a WorkSafe ACT event.
And we love Jacqui, and Jacqui is amazing.
Yeah. So on to you, Jacqui. I think fines are an interesting thing because I wonder how you view the severity of fines or undertakings for WHS infringements, because this is a big part of the bringing people into line with fines before any tragedy happens. But are the fines commensurate with other breaches of the law?
So it's interesting with the infringements because there are certain offences under the Act where we can go out and issue an on-the-spot infringement. But currently in relation to psychosocial hazards, it's really difficult to infringe because infringements are strict liability offences and psychosocial hazards aren't usually a black and white issue. The fines are approximately, our infringements are approximately $3,600, and we don't often see a great response to that. But where we've had some recent changes, such as in relation to silica, and we have fines that are now $6,000 for dry cutting, for instance, for silica hazards, we're getting much more of a response to that. So from my perspective, and I'm sure Narelle feels the same, we would absolutely welcome an increase in those infringements.
And Narelle, you said you've made an enormous amount of money back into WorkSafe Victoria from fines and infringements? You have got a bigger population, as Jacqui pointed out.
I do, and I just want to jump on what Aaron said. So we had a look on my LinkedIn page, Narelle Beer LinkedIn. We just very recently...
See, she's always plugging herself. It's
I thought I was in Victoria because it was cold and wet, so I apologise. But we just received a $650,000 fine because a company didn't follow their processes. So people were out there working, there were policies in place, procedures in place, and the duty holders didn't ensure that they were followed. And that cost the duty holder $650,000. Yes, there was a fatality. That money won't bring back a loved one. That money won't make the loved one's family feel better, but it's a significant impact on the company.
Do I have any questions from the floor? If you have, just raise your hand and we'll have over here. Yep, thank you. If you could just introduce yourself.
Thanks. Hi, I'm Carolyn Walsh. I'm the CEO of AusHelp. We do suicide prevention in hard-to-reach and high-risk industries. And so on that, there was some talk about suicides of patients. I'm interested in whether there's been any prosecutions after a suicide of a worker and how that went.
It's in Victoria, so you...
No, you go because I've monopolised.
as usual.
The short answer is yes, and there are currently prosecutions underway, including one by Comcare of the Department of Defence following the suicide of a Defence member. There's been an increase in prosecutions in this space across the board. I anticipate there's going to be a greater increase than what we've seen already over the last few years. To answer the question, yes, there's certainly a high-profile one, and it was of Court Services Victoria, an absolutely tragic...
Victoria.
Yeah, Victoria. Victoria, I think it's safe to say, we work across the country, so we got that benefit of looking at every jurisdiction, is leading the way in a number of areas, and really important areas. One is this one. One is prosecutions where there hasn't been an injury. And I think that's what the health sector can expect to see. You know, we have... in our assessment, these kind of three categories of offending, which is, and it relates back to this court services matter, you have a failure in systems, and that's where the front-end work of regulators is now, the proactive stuff. Then you have, most categories are going to sit in this fail to respond. In 2024, workers report bullying, they report harassment, they report sexual harassment. I can guarantee all of you that there are a lot of examples where there's no response still, it happens, or the response is inadequate. This was a case of a lawyer who had experienced a significant workload, who had experienced a allegedly toxic work environment, had ultimately taken a long period of leave. There's a lot of relevant facts. I'll just focus now on the salient ones. Was concerned about what colleagues, and lawyers are a weird bunch, concerned about what colleagues would think about their absence from the workplace. Lawyers have a problem with taking leave and turn up when they're sick all the time. Took leave, and at the end of the 3 months, couldn't bring herself to return to work, committed suicide. And there was a failure within a government entity over a protracted period to do what sits in this middle category of offending, respond to things that were known in the workplace. To round out that answer, the third category is the conduct, which clearly amounts, positive conduct, which clearly amounts to a breach of the expectations in now psychosocial codes of practice around the country. Again, Victoria, notable example, made current affairs, stringing a worker up in a hazing ritual at a glass factory. That stuff's still happening. That's the low-hanging fruit. That's easy to see. That's easy to prosecute. The first category is the hardest. The most is going to be in this failure to respond. It's mentioned it in my opening remarks. These most tragic of outcomes from not doing enough where things are known, and it happens certainly in this sector because, particularly in public health, the budget's just not always there to do what CEOs and their teams want to do.
On that, Aaron, the failure to respond, and you mentioned the legal profession. I don't think that's unique in the legal profession, this situation. But the failure to respond, where does it lie, the responsibility lie with the employee to seek help, and where does the responsibility lie with the employer to provide it or to comply?
Yeah, so again, psychosocial hazards, the injuries, the risks from those hazards are in a unique category, it's the challenge for big business is to design the systems, I suppose, so that workers don't need to report anything. But yes, there will be times when the worker will get a better outcome from having reported, but it's back to point one. They need to feel that they work in an environment where they can report it, and they quite simply don't always feel comfortable.
Yeah. And Jacqui,
Yeah, and ultimately the obligation sits with the PCBU to make it their business to know what the hazards are in their workplace.
yeah, because then we've got the human rights at play as well. The human right, and I think in the health industry, you've got the human right of the patient and the human right of the employee. I wonder if any of you have. Another question. Yeah. Oh, sorry. Oh, we've got a. Thanks, Dr. Mellor.
I was privileged to write the Safe Work New South Wales Work Design Guide to manage psychosocial risk. And one of the issues that we highlighted in there was what we call hidden designers of work. So I'm going to move past the workload issue, which everybody acknowledges in health, and say, to all of you, what are you doing to help PCBUs identify those who are also designing aspects of the work who may not know that they're doing it? Like, I sit on a better culture group for health, and yesterday we were talking about an incident of poor records management design by IT consultants within a major South Australian hospital, but I'm sure it's equally applicable. And they weren't aware that they also had duties, and the consequence of that was increasing the workload on the healthcare staff who were operating an inefficient records management system. So I'm asking about, are you digging deeper to look at those who are designing work beyond the obvious?
Yes, so...
Unlike you not to jump straight in.
You're just giving me a go now, are you?
I got to break this up.
This is all friendly banter, can I
Love
say?
each
We
other.
actually really, really like each other. Oh, well, I like you.
I love you. I love her.
Hence, inviting Narelle to be here today. And of course, because Victoria are absolutely doing some wonderful things in this space. So in relation to digging deeper, the answer is that in the ACT, just let me say that.
Cold and
we have a psychosocial team of inspectors, and when they go out to workplaces, they're looking at the entire system of work to determine whether or not the system of work is in place to keep workers safe. I'm not sure if I've answered the question.
Because Jacqui, I know Victoria, you are able to prosecute, but in the ACT.
Thanks, you're on Victoria's side as well. So
Winner chicken dinner.
In the ACT, we haven't yet had a successful prosecution in this area for psychosocial hazards. Can I say that we have come close a number of times? Prosecutions fall over for many reasons, and some of the reasons that they might fall over are that witnesses refuse to come and give evidence. And we actually were having a discussion in our office yesterday about this, and how do we get over the fact that a worker is coming to court to give evidence against their employer, but then they need to go back to work the next week or the next day. And so particularly in this space, we have had workers who do not want to come and give evidence before the court. The DPP in the ACT also have tests for how they determine whether to proceed with a prosecution, but prosecutions might also fall over because there's competing statements. So some witnesses say something, another witness says something else, and so it's really difficult to determine whether or not that prosecution would have prospects. But it is the unicorn, and it's the unicorn that we will get to. I absolutely am certain we will find that unicorn. It's very close. But, I mean, you've had lots. You've got 5 on the go at the moment.
And we've just had a recent successful prosecution in relation to bullying where the fine was $1.2 million. $1.2 million. And
Does it change anything?
Yeah, absolutely. Absolutely it does, and it sends a real message. And I'm not proud of the fact that we have the opportunity to prosecute these matters because it means that there's harm occurring in our state. And I know you spoke of the hazing. We've got a matter currently before the Mansfield Magistrates Court where a young male apprentice who had a brain-acquired injury from a previous car accident was put in the back of a toolbox on a tradies ute and driven 40 kilometres across a corrugated dirt road into the town. This is 2023 that this is occurring. We had, in response to your question earlier on, we're investigating a nurse who took her own life in a workplace as a result of psychosocial harm, but used medicines from the hospital in order to undertake that. So that's a very complex investigation. How did they get the access? Who was aware of the psychosocial harm? Where was the supervision? So this is now a time where we expect you to know your folk. We expect you to lean in. And we know that Gen Z that are coming through have a different Maslow's hierarchy of needs. We know that they like working individually. We know that they're coming into the workplace with a lower resilience capacity. And then I hear duty holders say, oh, well, we'll have to bring them on board and, convert them to our thinking. No, we have to accommodate the new folk that are coming in. How do we make them safe? Because you know what? They're your and my children and our grandchildren.
Thanks, Ellen.
Lisha, is there another question? I was going to go to Aaron on that human rights, human rights issue that you
absolutely.
raised.
And can I just on the work side, in a lot of the cases we've examined, both inside and outside health, the controls cost nothing, and in a couple of notable cases, prosecutions in the health sector across the country, all that needed to be provided to the workers to minimise the risk, probably prevents the incident, but we'll never know, was get them the information about the patient or consumer. That's a systems issue. In a Victorian matter, 2017 incident prosecuted in 2020, the patient's daughter, over a period of days, repeatedly advised the hospital about the increased risk being posed by her father, who was making threats, had become fixated on a nurse. The system failed, the information wasn't provided to that nurse, and he was badly beaten with a motorcycle battery in a bag. I can keep going with examples about the failure to provide to, in a change of shift, for example, information that the worker needed to keep themselves safe. It doesn't cost money once the system's designed. I think from those cases we can see that there's more work to be done in that space. The human rights issue, we're talking about the health sector this morning, but I've mentioned that, my assessment is that the single biggest risk area is in the management of psychosocial hazards. If we look more broadly, though, we're seeing tensions of this kind in other areas. So psychosocial hazards, big business, including mines, the tension between worker privacy and the need for these people beside me to do their job. That resulted in FMG in Fortescue Metal in Western Australia agreeing to an enforceable undertaking of $1.2 million because they wouldn't, in the interests of privacy, and nobody wants their privacy trampled on, I get it, but we've got competing risks here. They wouldn't hand over personnel records to protect privacy. And so they were charged with 34 criminal offences. So that gives an idea of, in this balancing exercise, which way the scales are tipping. And same for human rights. Nobody ever wants to trample on, and we need to protect, and we're fortunate to live in a country where there's such a focus on the protection of people's human rights. But as I said in my opening remarks, I've spent too many hours, hundreds of hours, with families of injured workers, families of deceased workers. My firm view is we protect human rights up to the point that we don't put workers at serious risk of serious injury or fatal injury.
Thanks, Aaron. I know you have to all get to work. I'm very aware of that. But it's, I think, can we have time for one more question? Is that all right? One more?
Thanks, Lish. Maddie Northam, I'm the Regional Secretary of the Community and Public Sector Union here in Canberra. I'm really interested to hear more about something. I think it was something you said earlier, Narelle, which is you hear a bit in the healthcare industry, oh, this is just part of the job, dangerous industry. Now, we hear this a lot with our members, particularly those who deal with members of the community going through perhaps a severe mental health episode out in the community, so not in a hospital setting. And it's our experience that these members, if they don't just deal with it, and by deal with, I mean chase down the street with chains, knives, needles, meat axes, held hostage, then they're just told to change, go to a different team, rather than put in place, obviously, different controls to try and avoid those situations. Has there been, and I don't think there has been in Canberra, but has there been anywhere else around the country experiencing prosecuting this before there's an injury or even worse, a death?
Yes, and my background is 33 years in policing. So I grew up policing Victoria and then finished in the Northern Territory, so I get all of that. And we are absolutely looking at how can we jump in before something occurs. So recently in Victoria, we're currently investigating a matter where a Victoria Police member attempted to self-harm, and the attempt to self-harm was as a result of a significant critical incident that he attended. So we went in and had a look at their systems in place. How are they managing, trauma experiences? What are they pulling into that environment? How are we protecting those folk? And as a result, we issued 11 notices and a prohibition notice. So we're really jumping on board, and we're really trying to reach in before that happens. And I know that I've been probably, a bit of doom and gloom for some of the health folk here to say, we're prosecuting and we're big and we're scary, and I am first thing in the morning. But at the end of the day, we're also really supportive when you've got the processes in place. So there was a matter in Victoria recently where a nurse was COVID positive. Had been to the hospital, had been to the doctor, I think on 3 occasions, and on 3 occasions was confirmed that you are COVID positive and you can't go to work. This nurse worked in a number of health facilities, and each and every time that nurse went to the health facility, whilst being COVID positive and knowingly being COVID positive, signed in and went through all the processes that each of the medical facilities had put in place, all the processes and procedures. We went in and investigated 4 of those health facilities, and we commended them on their controls, and we charged the nurse who went knowingly outside of that process. Now, that nurse had clearly no prior convictions, was a single mum, and got a suspended sentence. So if you've got the policies and procedures in place, and you're leaning in, and you're looking at them, and you're looking out the horizon, what's coming our way, how can we get in front of this, then you're going to protect the best asset you'll ever have, and that's your people.
I think that's a great place to end. Now, I know there's probably so many questions that you still all have, because this is a huge area. And in the ACT, Jacqui, Agius, I really want to thank you for hosting this.
We love Jacqui.
This first breakfast. And questions as well, we have a QR code up there, so please scan it. All of the resources are on WorkSafe ACT. Anything you'd like to add in final comment, each of you, before we farewell?
Yeah, I'd love the opportunity just for a really quick final comment. It comes, Maddie, off the back of those comments that you made about what the feedback you get from your members. We, because of a past life, people who want a WHS lawyer Google you and find out that you're in a law firm and they can call you. A lot's being done, of course. It's not all doom and gloom to improve worker safety. Is enough being done? Perhaps not when you hear this. Psychological safety is very much, it's unique because it's very much about how workers feel. So you can, as a business in this space, feel like you've done anything, but you're not quite there yet if your workers don't agree. If your workers feel unsafe, there's still an issue to be addressed. This is the only industry where I have had, I won't give the figure, but I have had, they're usually nurses, finding us online, calling my firm and asking if there's some way that we can help them. We usually only advise business, and it's this sector where workers are Googling us, calling to say, I don't feel safe, I've reported it, what do we do? Some insight supported by what you said about the task ahead for this room. Thank you.
Yeah, and I think what Maddie said indicates, because I don't know about any of those things, and I'm sure my office doesn't know, I think what that indicates is people are still unwilling to come forward, and we've got a big piece of work to do to educate people about psychosocial hazards in workplace, and of course this morning is part of that, and for workers to understand that it's okay to report. We need to encourage workers to report, but I want to make it really clear that it is your business as a PCBU to know what the hazards are in your workplace, and the biggest risk to work health and safety is not knowing there's a risk, so make it your business to know.
And I'll just finish to say that my beautiful daughter's 27. She works in a public sector organisation. She came home the other day with a printout of an email that was sent to all the staff. And that email said, we expect you to stay back an hour or two every day to finish the work that you haven't yet finished, and no, it won't be funded, but that's our expectation of you. So I was very happy to get that email.
It's handy to have a mum who's the work health and safety regulator.
But it's really important that you know what your folk are doing. You know what's being said out there, because that's gold for me. And I also just want to call out one last thing, and that is just how connected the health and safety regulators are around the state. And we are really general when we say we really get along really well, but we also share information very, very well, and we get together monthly. We're looking what's coming over the horizon. What are some of the design things that aren't working? What are some of the trends that we're seeing? How can we get on top? Because we are absolutely all passionate about trying to reduce harm in the workplace.
Can you please give a big round of applause to our fabulous panellists, Jacqui Agius, Narelle and Aaron Guilfoyle. And thank you all for coming out this morning and spending this time, because I know it has such a huge impact on every industry, and these breakfasts will be rolling out every month across different industries. And if you do want to read the Steve Robson, it is behind the paywall, not on the Australian, but go to the AMA. I really, just for your sector especially, it's an incredible read just of his personal experience. And that's 40 years ago, I think he went through that. And thank you all again. And thank you WorkSafe ACT for pulling off this wonderful event this morning. Enjoy the rest of your breakfast.